Proctalgia fugax. Please, guys, listen carefully because this is one of the surprisingly common cases. Proctalgia fugax. And this is a new case we added to our curriculum as well just recently. You will have, guys, the file already uploaded on the website with the most recent updates. The same file I'm sharing with you guys now is the same file you are having on the website. Proctalgia fugax. Before I go ahead, guys, did anyone hear about Proctalgia fugax before? Anyone from your side, guys, or from yourself, did anyone hear about this condition before? None of you at all? We got plenty of people here. None of you guys heard about this condition. If you go to
Honorable said pain in the rectum.
yes, good. So Tanvir, you heard about it before. Pain in the rectum. Okay.
Oh, yeah.
Good. Did someone else, guys, hear about this before?
Yes.
Mariam as well.
Yeah.
Good. Guys, do you know what is the treatment for this one? You will be surprised. Do you know what is the treatment for this one?
CPT.
No.
Maybe CBT. If it is,
No.
there is no other physical cause.
Well, first line treatment is do nothing. But if we would like to prescribe something, you will be surprised, guys. Salbutamol inhaler. The inhaler for asthma, it can help with this condition. Sometimes even the GTN ointment or deltazine ointment down below. If you go to patient info, it tells you that 1 in 5 will have this condition. 1 in 5, that means up to 20%. If you go to GP notebook, it again tells you a very similar percentage. GP notebook says that up to 18%, which is very close to 20%. Although not all the people with this condition will come to the primary care, but the estimated prevalence is up to 20%. So it is quite common. You remember, guys, in Peyronie disease, we discussed in the main health, Peyronie disease. Again, if you didn't hear about Peyronie disease before, and thankfully we done this long time ago, Peyronie disease, okay? Again, we are introducing some other new cases to the curriculum so people will be aware. Especially Peyronie disease, by the way, is common. Peyronie disease is a common as well. Proctalgia fugax is also a common condition. All right. So what are the questions you need to ask in this condition? Basically, you are trying to rule out different causes for anal pain. Starting from IBD, especially Crohn's, okay, for ulcerative inflammatory bowel condition, IBS, maybe hemorrhoids, anal fissure is very important, okay, cancer symptoms, any worms or parasite, okay. So we are trying to rule out different things. Usually there is nothing underlying, and it doesn't come very frequent. Maybe in a year, your patient will have 5 to 6 attacks. It is intermittent. It comes in an episode. The painful episode will last up to 20 minutes, up to half an hour. Up to half an hour. Okay? So again, all you need to know will be in one slide. Then from the coming slide is a very good slide from patient info. I read GB notebook, I read patient info. Patient info is amazing in this. I couldn't find the CKS very clearly. So patient info is amazing in this one. So clarify pain through asking in more details about pain in Socrates. Plus, how long does each episode last? Usually seconds to minutes, and usually up to half an hour, not more than this. How often do you have this painful episode? Could you please describe your pain for me? How does it feel like? Does it wake you up at night or no? Anything that make it worse? For example, opening your bowels, having sex around your period time, any stress at all, any other symptoms, especially bleeding, change in the bowel habit, okay, ongoing diarrhea or alternative with bowel habit, any lumps, any swelling, any weight loss. So rule out, basically, guys, you need to rule out different stuff. itchiness at night, especially at night in the anal area, worms in the stool. Have you seen any worms in the stool, any stomach pain? Just to rule out any parasite. So here, ask about other differentials, okay, as per next page, but mainly at least rule out cancer, hemorrhoids or piles, parasite, IPS, IPD. You can ask, what did you try for this before? Definitely impact his eyes, social history. How you can explain it? Proctalgia fugax is a common and harmless condition. Common and harmless condition where you get sudden severe pain in the back passage that lasts a few seconds or minutes, and then it goes away. It is caused by a brief muscle spasm in this area, and it doesn't indicate anything serious like cancer. Although it can be very uncomfortable, it usually goes away on its own. Goes away on its own. Okay. So management addressing the eyes, give him diagnosis, face-to-face examination, self-help measures. We'll come to self-help measures, medications if needed. Okay. Signpost him to some resources. Patient info is amazing. Follow up if needed, and safety net. Follow up if needed. Why? Because if you are not giving him any salbutamol, you are not giving him any GTN ointment, okay, you don't need to follow up with him. But if you are giving him any medications to help with his symptoms, you probably need to follow up maybe after some time to assess is it effective or not. So explain to the patient it's not dangerous. The assurance is the key. Discuss the frequency and impact. If it is not frequent, very mild, there is no treatment needed. If it is infrequent and mild attacks, no treatment needed. If it is really frequent, giving him discomfort, very unpleasant feeling, consider treatment options and discuss the options with him. What are the options for this? There are some medications that we can prescribe, and also there are some self-help measures. For example, what are self-help measures? Taking or a warm bath, okay, during or after pain, gentle massage of the area down below, relaxation technique or stress management if there's any underlying stress, avoid constipation. So high fiber diet, well hydration, regular exercise, breathing technique during the episode to reduce the spasm. Take a deep breath during the episode to reduce the spasm. What we can offer him, as we mentioned, face-to-face, okay, we need to see, to make sure, and if you bring for face-to-face, you need to explain what you are planning to examine. I will just examine from down below to see if there is any rash around, if there is any fissure, if there is any piles, even sometimes internal piles as well that you can't feel it from outside. Some people will have internal hemorrhoids inside your back passage. It can give you also painful episodes from time to time. That's why if you are happy, you can come for face-to-face. I will examine you from down with a chaperone. What we can offer, salbutamol inhaler. 2 puffs at the onset of the pain. It is off-label use. And explain to him, it is not licensed, but some people find it very effective in terms of easing the acute painful episodes. Don't forget, off-license. Topical GTN also can be an option. Consider nerve block injections if severe and persistent, but we don't do, we refer. Safety net, come back if symptoms change, any new symptoms, any blood diarrhea, change in the bowel habit, any weight loss, all of that, any bleeding, please come back. Signpost into patient info UK. This is Proctalgia fugax. If you didn't read about this before, and you will have it in your daily practice, or you will have it in the exam, you will stop. It's worth reading about this. And as you can see, we are trying to introduce more cases to our curriculum. And usually we try to look for the common cases, guys, that it is having good prevalence, to be aware of this. Okay? Not a rare case presentations. That is, if you have it in the exam, you might be unlucky, although it can happen. But something like this prevalent is quite common. It's worth knowing about this for your daily practice and for your exam. Personally, I had it in my daily practice. A few weeks ago. This is about Proctalgia fugax. Okay, so all you need to know in this slide. If you need more information, A very good table. There is another condition called levator ani syndrome. Okay, so it is a chronic anal rectal pain due to levator ani muscle issues, also called chronic anal pain syndrome. It's worth reading about this for your own knowledge if you need more information. But I put it here in a table, guys, because you need to be aware of different presentations for chronic or not chronic, because Proctalgia fugax is not usually chronic. Okay, but at least to know a differential diagnosis from Proctalgia fugax and also to be aware of how common both of them. Proctalgia fugax is common up to 1 in 5, up to 20%. The chronic anal pain syndrome is less common, 6 in 100 people, 6%. So it is less common, less common. Okay, so it's worth knowing about them. So Proctalgia fugax, sudden severe feeling of anal or rectal pain due to the muscle spasm. Okay, cause usually we don't know, but there is usually spasm in the anal sphincter or the levator ani muscle. Symptoms, as we mentioned, sudden severe cramping pain, plus seconds up to minutes, usually up to 30 seconds. There is no bleeding, no any other symptoms at all. There is no any underlying symptom or any underlying illness. So you will not find any weight loss, any irritable bowel syndrome, or inflammatory bowel disease symptoms, anything like that. Investigation, usually we don't need any investigation. Just face-to-face, examine him, and that's it. It's mainly a clinical diagnosis, mainly clinical diagnosis. Treatment, as we mentioned about this before, prognosis, usually self-limiting episode. Okay, they may recur occasionally with long symptom-free interval. They may like few years and then it comes back. Okay, and it is not as serious. And here, just other causes of anal pain. It is just a differential diagnosis that you probably will need to ask in your case. Don't forget prostatitis in men. We mentioned, guys, in the men health chapter, prostatitis can come with painful defecation, painful ejaculation, painful urination, and deep perineal pain. Okay. There is something called biofeedback therapy and electrogalvanic stimulation. It is a treatment option for levator ani muscle. Just in case if you will be asked about this, I wonder because the most common here among them is the Proctalgia fugax. So mainly if you will have one in the exam, it will be Proctalgia fugax because levator ani is much less common. It's about 6%, the other one is up to 20%. But just for yourself, you can read about what is biofeedback therapy, what is the electrogalvanic stimulation. Okay, just basically we are trying to induce some muscle contraction in the pelvic floor muscles, and patient can learn how the muscle contraction happens. So he can build up some stress down below. So this is a type biofeedback therapy, a type of therapy whereby you learn how to relax your pelvic floor muscles by yourself. Electrodes are attached inside your back passage, providing a trace which shows that shows you what happens as you try to relax and contract the muscles. Okay, just nerve stimulations for the muscles. Okay, it will contract and relax the muscles. So patient will understand how it looks like, how he should contract and relax the muscles. He will need severe sessions until the patient will understand fully how he can contract and relax the muscles by himself. Electrogalvanic stimulation involves stimulation of the anus by an electric current through a probe placed inside. This is thought to be less effective than biofeedback. It is just, guys, about this case. I hope, guys, you now know what is this case about, because if you didn't read, as I mentioned, that might be tricky for you. I know, guys, this case is not in the hard copy that we have sent up to yesterday. You have seen many hard copies. This case is not there. And as you know, guys, anyone who had a hard copy is allowed to have an updated hard copy later on. A updated copy, just the few cases that we will add. This case will be entitled in the updated hard copy. You will have only one file. We will put in this hard file this case, Proctalgia fugax as well. So don't worry if we didn't have it in the hard copy, the original one. The updated file that you will have before your exam, it will be there. Don't forget, don't worry about this. Guys, we finished the gastro. Any questions about this, including the last interesting case?